Welcome everyone to San Diego Brain Injury Foundation's Saturday speaker group meeting. And today we are really happy to have Dr. Gary Seale with us. Dr. Gary Seale is the Regional Director of Clinical Services for the Center for Neuroskills. The topic today is a change in positive emotion and recovery of functional status post-brain injury. Dr. Seale is going to be talking a bit about the relationship between experiencing positive emotions and health well-being. This presentation will provide some simple strategies to boost positive emotion. I think a particularly relevant topic during the times we're in these days. So without further ado, I'd like to welcome Dr. Seale and just join me in welcoming him and thanking him for spending some time with us on a Saturday. Thank you, sir.
Thank you, and you guys are actually doing me a favor. It is high noon here in Galveston, Texas, where I live. It's about 85% humidity, mid-90s, so the heat index is about 110, and until about 30 minutes ago, my wife had me in the yard doing some honeydew, so this is, I'm getting a welcome break in the AC, so thank you for having me. I appreciate it. Can I share my screen now?
Yeah, you sure can.
So this is a decision tree that I generally post for a few minutes when I deliver this talk live. And when I begin the presentation, I generally ask people, so what is this decision tree saying to you? And after people examine it for a while, the standard answer that I get is, well, it appears from this decision tree that there are things you can do to change your emotional state. And that is the correct answer. In fact, I think it was Abe Lincoln who is credited with the saying, people are about as happy as they choose to be. And interestingly, science is starting to bear that out. We're going to talk about some of that, that science later today. All right. Okay, so again, the topic today is change in positive emotion, recovery of functional status after a brain injury. And we're going to examine the relationship of emotional state and how they are associated or how they impact change, functional change after a brain injury. So our agenda today is to review some statistics, risk factors. This information is very familiar to this audience, so I won't spend a lot of time talking about that, but I do want to spend some time talking about variables that are associated with recovery from a brain injury, particularly the role of experiencing emotional states, both positive and negative. I want to share with you a research study that some colleagues of mine and I at the University of Texas Medical Branch in Galveston conducted a few years ago that shed some light on this topic. And then I want to share with you some simple exercises that can boost your daily experience of positive emotions and maybe have an impact on your health and well-being. And as always, I want to share some resources. There are lots of great resources, websites, books, that you can, websites you can visit, books you can read if you want to learn more about it. And then we'll save some time at the end for your questions. So let's get going. So again, brain injury is among the leading killers and disablers of young adults in the U.S. It is an epidemic. And again, these statistics are very familiar to you. Somewhere between 1.7 and 2.4 million Americans sustain a TBI each year. More than 10 million Americans live with at least one disability from a brain injury. And it has a huge impact economically in our country. There are a number of risk factors associated with brain injury, both TBI and stroke. Substance misuse is a risk factor for both. For TBI, it's generally drinking and driving. For stroke, chronic alcohol intake can affect clotting, blood clotting, can cause blood clotting disorders. It's related to hypertension, diabetes. All of those are risk factors for stroke. For traumatic brain injury, gender is a risk factor. Guys are much more likely to sustain a TBI than women, because guys, quite frankly, do stupid stuff, and young guys do real stupid stuff, right? So engaging in risky behavior oftentimes leads to an injury. For stroke, unfortunately, it's lifestyle change, lifestyle choices. We tend to eat too much and maybe drink too much, smoke, not exercise enough. And again, all those are risk factors for stroke. The consequences of acquired brain injury, again, are multiple. There are cognitive, physical, emotional changes that occur with a brain injury. Some individuals experience pain and communication difficulties. Some of these can combine to decrease life satisfaction and quality of life, but that is fortunately there are rehabilitation options available, and many individuals do recover from brain injury and go on to lead productive and satisfying lives. And I'm sure many of you have those stories to tell. There are a number of factors associated with recovery from brain injury. And again, I want to share these with you, but tell you that these are statistical averages. You know, we all know folks that can beat the average or beat the odds. So what I'm going to share with you in terms of these factors of recovery are statistical averages. So generally speaking, younger people tend to recover more fully, sometimes more quickly than those that are older when they sustain an injury. And what I'm referring to generally are young adults. I'm not talking about pediatrics. That's a different discussion altogether. Gender is a factor associated with recovery, and interestingly, women tend to do better than men for a couple reasons. Female hormones are thought to be protective, neuroprotective, and also women tend to have deeper and richer social networks. Women tend to talk about what's going on with them, share their feelings. Men, not so much. We don't like to ask for directions, and sometimes we don't like to ask for help either. So because women are more connected and tend to share their feelings and ask for help, they tend to fare better. Obviously, the type and severity of injury is important. Less severe injuries tend to produce less severe consequences. Socioeconomic status, particularly as it relates to having insurance, is important. So individuals who have insurance, who have an automobile to get back and forth to appointments, who have a supportive family, all those things are important in recovery. Time to initiate treatment is important for a stroke. Individuals who can get to the hospital within 3 hours of initial onset of symptoms can be administered TPA, and that impacts outcome in a positive way. The same goes for traumatic brain injury treatment. Generally, individuals who are able to get into post-acute care within the first year of injury have much better outcomes than those who come to rehab later. Intensity, duration, quality of treatment. Obviously, a brain injury is not something that can be treated with a few sessions of OT, PT, and speech, right? It requires a comprehensive treatment team led by a case manager, 5, 6, 7 hours of therapy a day, and also a duration of therapy to deal with all the consequences that often occur following an injury. And finally, last but not least, what we're going to focus on today is emotion and experiencing positive or negative emotions following injury can have an impact on recovery. And that's going to be our focus primarily for today. So it's been widely recognized by the Institute of Medicine and other groups that the environment influences disability, and there are physical environments and there are also psychological or internal environments. For example, a physical environment might include a building. A building is either accessible or inaccessible, right? If a building has ramps and curb cuts, elevators, wide doors, automatic door openers. That building is accessible. It enables people to access whatever's going on inside that building, be it a restaurant or a bar or a movie theater or a playhouse. If there are not curb cuts and ramps and door openers and widened doors and accessible bathrooms, then that is a disabling environment. People with certain mobility limitations would not be able to access what's going on. The Institute of Medicine also recognizes that internal environments can be enabling or disabling. Individuals who experience illness and injury as something terrible, horrible, and awful, they feel victimized, tend to have less robust outcomes than individuals who experience an injury or an illness as a challenge to be overcome. They want to find out what they can do to improve their life, and they take action. So again, physical environments can be enabling or disabling, and internal or psychological environments can be enabling or disabling. And again, that's going to be our focus of our presentation today. So when we talk about or think about emotion, the negative emotions, anger, sadness, anxiety, those kinds of things were pretty much the exclusive focus of psychology and psychiatry for almost a century. And this wasn't such a bad thing. As we studied the negative emotions, a number of treatments were developed, cognitive and behavioral and pharmacological, to address depression and anxiety, substance misuse, anger, and a number of people have been helped with those or through those interventions. The study, the robust scientific study of the negative emotions, also revealed that experiencing negative emotions regularly is associated with disease onset. So people who experience negative emotional states are sick more often and may not recover from an illness or an injury completely. And the reason is because when we experience negative emotions, again, anger, fear, sadness, anxiety, it triggers the fight or flight response or a stress response, right? And so there's this cascade of hormonal release, including cortisol and adrenaline, and these crank up our cardiovascular system. Our breathing becomes rapid and shallow. Blood moves from our digestive system into our big muscles so we can run, fight, or hide. And so our digestion slows down. And so over time, when we stress our cardiovascular and our respiratory systems, our digestive systems, it can impact, it can cause weight gain. It can produce sleep disorder, all kinds of problems that can lead to cardiac disease, and eventually to things like a stroke. It also limits our response repertoire. When we are in negative emotional states, it's sort of hard to get ourselves out because all our body or all our brain is telling our body to do is to run, hide, freeze, or fight. So again, negative emotions can have an impact, a negative impact on our health and well-being if we experience them regularly and we sort of stay stuck in those negative emotional states. But there's good news. In the mid-1990s, Martin Seligman became president of the American Psychological Association. And he asked the question, well, what if we take the same scientific rigor that we have applied to the study of negative emotions and we turn that around and we look at what's right with people instead of, trying to figure out what's wrong with them and focusing on this disease model of human functioning? What if we look for what's right about people? What if we spend time trying to identify attitudes and behaviors and health practices that are associated with good health and great relationships and contentment and life satisfaction? What if we try to figure out what those people are doing that makes them healthy and apply that to others? So Martin Seligman and a group of researchers set off to find out what they could learn from healthy, happy, and productive people. And through this rigorous scientific investigation into the positive emotions, a number of strong correlations between experiencing positive emotion and health outcomes began to be published. And so what we learned very quickly was that people who regularly experience positive emotions tend to be healthier and they tend to live longer. They don't get sick as often, and when they do get sick, they bounce back more quickly. They tend to engage in healthy behaviors and activities more often, so they will take the time to go see their doctor annually for a checkup. If they're prescribed medications, they'll take them. They tend to engage in healthy behaviors like watching their diet, maybe exercising more, maybe drinking and smoking less. They tend to have rich and deep social networks. I'm not talking about 1,000 Facebook friends. I'm talking about real people that they talk to, spend time with, and these relationships are mutually beneficial. They also understand and employ positive coping techniques. We're going to talk about coping in more detail later, but they tend to identify a problem. They tend to try to find out what they can do to address that problem. They lean into it rather than avoiding it, and they do things like ask for help and take charge of things they can take charge of to improve their situation. At work, people who experience high levels of positive emotion tend to be more productive, and they're statistically, they make more money. So I tell people all the time, get happy and get yourself a raise. And the positive emotions, unlike the negative emotions that tend to decrease or limit our response repertoire, when we experience positive emotions like joy and gratitude and curiosity, it triggers a release of dopamine, endorphins, and enkephalins. It actually lights up all of the learning systems in our brain, and it broadens our response repertoire so that we can cooperate and collaborate. People who are in positive emotional states, research shows, even process information more quickly and more accurately than people who are in a negative emotional state. And again, as I mentioned earlier, people who regularly experience positive emotions tends to be protective from disease onset. So again, people who regularly experience positive emotions are sick less often, and if they are sick, they tend to bounce back quicker. So there were some early critics of this whole idea about emotion being associated with health and well-being. And these early critics said things like, well, aren't positive people just sort of born that way? I mean, don't people just sort of come out of the womb with this glass half full kind of a perspective on life? And aren't positive emotions just sort of the flip side of negative emotional states? And the answer to that is no, not at all. Research has shown that there are different personality profiles associated with positive emotional states and negative emotional states. For example, if I were to deliver a questionnaire to this group and ask you, over the past week, have you been pretty much positive, optimistic, happy, contented, or have you been, negative, angry, sad, depressed? And then if I were to accompany that with a personality profile, those of you who reported high levels of positive emotion would likely score high on extroversion and other measures associated with personality traits. Those that reported experiencing high levels of negative emotion would likely score high on things like anxiety and neuroticism. Positive and negative emotional states are also associated with different biological markers. Again, if I were to administer a questionnaire about your experience of positive or negative emotional states over the past week and draw your blood, I would likely find in people who expressed high levels of positive emotion, greater T cell density, immunoglobulin A, which both of those are indicators of a robust immune system, and very low levels of cortisol, the stress hormone. For folks who reported high levels of negative emotion, it would be the opposite in terms of biomarkers. And finally, we have understood through research that positive and negative emotional states are also mediated by different neurotransmitter systems in the brain. So they are very different operational systems within our brain and our body. So this research group that I work with at University of Texas Medical Branch in Galveston started looking at this, wondering if the experience of positive and negative emotional states had some sort of an association with outcome after rehabilitation for a brain injury. We knew from looking at the literature that positive emotional states protected people from disease onset, that positive emotional states were associated with better functional outcomes following illness or injury. But these studies were all pretty short in duration, and they only measured positive emotion at one time point. So these were, again, very brief correlational kinds of studies. And what we wanted to know is whether or not positive emotion can change over time. And if it does, how does that impact the trajectory of recovery following a brain injury? So for example, if people experience positive emotion more often than negative emotion after an injury, do they have better functional outcomes than those who experience negative emotions more regularly? So those are our research questions. So I don't want to get too deep in the weeds of this this research study, but I want to share the results because again, it has bearing on what we're discussing today. So we recruited about a dozen acute rehab centers across the United States. Those states that are shaded are the states where we had research agreements with hospital-based rehabilitation units. So again, you can see we had a pretty good spread of hospitals across the United States. We were looking primarily at stroke, but we've since applied this research to traumatic brain injury. But we were looking initially at folks who had a diagnosis of stroke, who were 55 years or older, because generally speaking, people experience stroke during the first stroke during their 5th decade. And so we looked at people who were 55 and older. We looked at all racial and ethnic groups, but we actually tried to recruit more Hispanics and African Americans because they tend to be lacking in a lot of research studies. And we want to make sure people obviously were cognitively appropriate and could consent. They weren't had not been declared incompetent, or they did not have a guardian or a conservator. So we obtained IRB approval. We collected data within 24 hours of admission to the rehab unit and within 72 hours of discharge. And then we followed them up at 3 and 12 months with a phone interview. So we followed this group of people for an entire year, looking at a number of variables. One of the things we wanted to look at, obviously, was positive emotion. And so the Center for Epidemiological Studies Depression Scale, say that real fast, 5 times, I dare you. The CESD, as it's called, is a 20-item measure looking at depressive symptoms, but it has 4 items that can be used as a positive emotion scale. And these 4 items where I felt just as good as other people, I felt hopeful about the future, I'm happy, I'm enjoying my life. And individuals rate that on a 0 to 3 scale, 0 meaning I never feel that way, or 3, I feel that way all the time. So these 4 items combine to give a summary score, positive emotion summary score, that ranges from 0, which is very low, to 12, which is very high. And so that was our independent variable. That was the variable of interest, and our outcome variable was the functional independence measure, the tried and true FIM. Many of you may be familiar with that instrument. It covers a number of domains like self-care, continence, transfers, communication, cognition. Items are scored on a 1 to 7 scale, and you wind up with a total score ranging between 18 and 126. The higher the score, the more independent the person is. So again, we wanted to see, as positive emotion fluctuates, does that have an impact on outcome or functional independence as measured by the FIM? That's a question we're trying to answer. So again, here are the variables that we collected. Again, we collected a number of variables about demographics and injury characteristics at admission, as well as FIM score, And then at discharge, we looked at FEM and also positive emotion. And we did that again at 3 months and at 12 months. We had a total sample of over 1,200 people, so a big group of folks. Some of those did not meet inclusion criteria, and we lost some along the way. But by the end of the study, we still had a sample of almost 700 from across the U.S. So this is a pretty big sample, pretty representative sample. And generally speaking, they were about 80 years of age, spent about 3 weeks in the rehab unit. They were about equal number male and female, about equal number married, not married. Unfortunately, even though we oversampled for Hispanics and African Americans, it was a pretty white sample. About 80% were non-Hispanic white. Most folks had more than 12 years of education. The majority of folks had more than 2 comorbidities. So we're talking about diabetes, hypertension, obesity, and about 90% received some therapy either at a post-acute outpatient unit or home health after they discharged from the rehab unit. So there were some racial and ethnic differences noted. White participants tended to have longer lengths of stay. African Americans were younger at the time of stroke, were often times not married, and generally discharged home from the hospital rather than going to post-acute rehab. And Hispanics tend to have less formal education, but we found no other differences in those 3 racial or ethnic groups. So our first question was, does positive emotion change over time? And yes, it does. About 41% of our sample reported ever increasing levels of positive emotion over that first year. About 36% said, no, I'm pretty much staying the same over time. About 22% reported a decline in their experience of positive emotion over time. Interestingly, about 160 of that 700 patients that reported no change reported the highest level, a 12 on that positive emotion summary score across all time points, at discharge, at 3 months, at 12 months. It's really interesting because you would think that having a stroke and being hospitalized and all that comes with that would at least for a brief period of time have people in a negative emotional state. But there were 160 people in this study who scored the highest across all 3 time points. And interestingly, we call this our resilient group because they had the shortest length of stay. They had the highest FEM ratings at discharge and the lowest reported depressive symptoms. So these people were really happy. They were really positive. They got better quicker, and they got better than the rest of the folks that we studied. So really interesting group. We're still studying this resilient group, trying to figure out what it is about this group that makes them so different, and what can we learn and share with others about that. So we found something interesting when we looked at change in positive emotion over that year and broke it out by age categories. The purple line at the very top, those folks that started out with the highest level of positive emotion and stayed high, were the oldest group. These were 85 and above. And if you look in the literature, this is to be expected. We have this idea or this assumption that old people are grumpy. They're the people that come out and bark at you about being on their lawn, or your dog barking, or your kids, playing in the street. But generally speaking, when you look at the literature, older people tend to be the most positive. They have generally good coping skills. They have a support network. And if you live to be 85, you've seen some stuff. You've been through some stuff. So you've developed some resilient coping strategies that help you remain positive. The youngest group, the 55 to 64, were the lowest level, had the lowest level of positive emotion. But again, by the end of that first year, they had caught up and surpassed the older group. And again, this is to be expected as well. I'm in that group. I'm about to leave that group, but I'm at the upper end of that group. I'm still working. I have 5 grandchildren. I love to travel and go visit them. So if I had a stroke at this age and stage of the game, it would impact my ability, at least initially, to go back to work, to maybe spend time with my grandkids, to be active, doing the things I enjoy doing. So I would take a hit emotionally. But again, over time, as I recovered, I would regain that positive outlook, and that is what happened with our group as well. Also, interestingly, when we looked at change in positive emotion, according to racial and ethnic groups, there were some big differences. The Hispanic group started out with the highest level of positive emotion, but at the end of the year, they were at the lowest. Caucasian and African Americans started low, but then both of them were high at the end of the 12-month study, African Americans being the highest. And so we researched this, and again, people actually, let me back up. I talked to some Hispanic researchers, and they thought this was to be expected. Individuals who are in Hispanic families, the patriarch generally is responsible for working, for providing for the family, paying the bills, that sort of thing. And if they're unable to fulfill that role, it is a huge emotional, they take a huge emotional hit for that. Same with women who are taking care of the home and family. If they're not able to fulfill that role to their satisfaction, again, it has a huge impact on them emotionally. And so that was something that our colleagues were able to explain. And when we look at our second question, does change in positive emotion have an impact on functional recovery? The answer is also yes. So that green line, the highest FEM levels are associated with the people who increased their level of positive emotion over time. The yellow line in the middle are folks who stayed the same, who didn't change from discharge to the 1-year follow-up. And the red line are folks that experienced a decline in positive emotion over time, and they had the lowest FEM ratings at the end of the study. So to answer the question, does positive emotion change over time? The answer is yes. And does change in positive emotion impact the trajectory of recovery following a stroke? And that answer is also yes. The majority of change occurs within that first 3 months. And there were, again, some racial, ethnic, and age-related differences when we looked at change over time. So as all good research studies do, it raised more questions than it answered. So if positive emotion is a dynamic process that can change over time, and it is, and if change in positive emotion is associated with recovery of functional status, and it is, well, then the next question, obvious question, is, can positive emotion be influenced? That means, are there things we can do to boost people's level or experience of positive emotions and maybe have an impact on their recovery? And the answer to that also is yes. And we're going to get into some of that information right now. So the good news is that positive emotional states are modifiable. Jonathan Haidt, H-A-I-G-H-T, in the happiness hypothesis has done the research in this area, and his research shows that about half of our dispositional optimism or pessimism, whether we see, again, the glass half full or half empty, comes from our genetics, from our mom and dad, from the home we grew up in. About 10% of our dispositional optimism or pessimism is directly associated with our circumstances, where we live, where we work, who we hang out with, although I would say that's modifiable. You can always change what you drive and where you work and who you hang out with. But his research showed that a full 40% of our experience of emotion, either positive or negative, is under our direct control. And that's good news. That means we can do things to, in any particular situation, boost our level of positive emotion. And again, maybe have an impact on our health and well-being. And so that's what we want to focus on for the remainder of this talk. So Martin Seligman, the guy I talked about in the beginning of the talk, and his colleagues who were looking into positive emotional states, identified a number of simple activities that can boost positive emotion. These were tried on college populations as well as clinical populations, and they found that by engaging in some of these activities, you can boost your level of positive emotion, and it can have a positive impact on your health and well-being for up to 6 months. And again, remember, the more we're able to experience the positive emotions, the healthier we will be. It is associated with longevity, and it can have, again, a positive impact on our relationships and our recovery from illness and injury. And they identified 3 domains where people can experience positive emotion. One was pleasure, experiencing positive emotions through the senses. The other was engagement, understanding what you're good at and using it in your work to solve problems, to overcome challenges, and also in the area of meaning. This is a broader, almost a spiritual kind of a domain where we connect with something larger than ourselves. So in the area of pleasure, watching a beautiful sunrise or a sunset, enjoying therapeutic touch from massage or the touch of your grandchild, listening to an inspiring speech or meditative music, reading something inspirational. All those things can boost our experience of positive emotion in the moment, but it's fleeting. And it goes away, and we're off to the next thing that makes us feel good. Where we get the biggest bang for the buck is engagement, knowing what we're good at and using our strengths to accomplish a task, reach a goal, solve a problem, overcome a challenge. And also, when we use our strengths in new and different ways in the service of others, or when we connect to something larger than ourselves, we experience, awe and gratitude, again, which are positive emotions, and again, can boost positive emotions immediately and have an impact on our health and well-being for months later. So there are a couple ways that we can increase our experience of positive emotions. One is by decreasing the negative. And by decreasing the negative, I mean, being aware of your thoughts. And if they're negative, if they're below the line, as we call it, then we want to do something to get out of that negative emotional state, not get stuck there. And so the ways we can do that is avoiding overgeneralizations, like always and never. I'm always messing up. I never do the right thing. Get those words out of your vocabulary. Also, we can counter that negative thinking by just checking the facts. Is that really true? Am I always messing up? Well, no, yesterday I had a pretty good day. I went to work. I accomplished my to-do list for my wife. I helped out someone in the community who had a flat tire. Well, that's not true. I'm not always doing things that are not appropriate. And we can also, again, sort of reframe our thinking about what's happening right away, and be present. Also, I don't know if I'm the only one in the room, or maybe sometimes you guys wake up in the night and you're staring at the ceiling fan and you're thinking about something over and over and over again, and you really can't sort of break out of it. So again, there are things we can do to break that grip of rumination or perseverating on, again, a negative thought, a negative topic, a negative outcome, by going out, enjoying nature, exercising, getting those endorphins and enkephalons and that oxygen going to your brain. We can read or watch something inspirational to change our mood. We can also talk with a trusted friend, or just talk to ourselves like we would a trusted friend. We tend to be harder on ourselves than we are on those around us. And we can, sometimes, I know this is true for me, my self-talk can be pretty harsh. And so I have to get out of that and talk to myself as a trusted friend or colleague would talk to me. And lastly, we can decrease the negative by assessing our media diet. And so if you want to experience less anger, sadness, stress, turn the TV off, get off Facebook and Twitter for a couple. Just take a fast. from all forms of media for a day or two, and see if it doesn't improve your mood and your sleep. So those are the things we can do to decrease the negative. Now I want to talk about how we can increase or boost the positive through some intentional activities. One of the things that's been shown to boost positive emotion is achieving goals, solving a problem, overcoming a challenge. And so if we every day can write down, set some reasonable goals and revisit them and reward ourselves for accomplishing that task, celebrate those achievements, we get a boost of dopamine and experience positive emotions. If we can be present, develop a meditative or a breathing practice. And I will tell you that there are a number of free apps on your smartphone that you can download that can take you through a breathing exercise or meditation exercise. And if you do this just for a few minutes, several times a day, again, you're going to feel relaxed, less stressed, and more positive. Exercising, and it doesn't have to be a lot. It can just be moving for 20 minutes a day. Again, it releases endorphins and enkephalons. It causes us to breathe deeply. It oxygenates our brain, and it produces positive emotion, as does enjoying the beauty in nature. And you guys are in a beautiful part of the country in San Diego. I'm so jealous of where you're at. These are some positive emotion strategies that were developed by the folks, Martin Seligman's research group, and again, piloted on college populations and also clinical populations. So one of the best ways to boost emotion is just to be grateful. And the way we do that is to start a gratitude list. Write down, during the day, things that you are grateful for, and they can be little bitty things. Grateful that that you got up today, that you were able to spend time with a friend, you had a wonderful meal. Another thing is to think about at the end of the day, to think about 3 good things that happened today. Write them down, and after you write them down, think about what you did, what your role was in making those 3 good things happen. You can write a letter of thanks to someone, or if that's difficult for you, you can write a note, either a text or an email, and send it to someone, and then watch their response. I promise you, if you can hand deliver it, or even if you send it through an email or a text, you'll get a big boost in positive emotion. The other is to complete a BAT exercise, and Michael Frisch developed this. BAT stands for blessings, achievements, and talents, and just 3 columns with those headings. And you write down the things that you're grateful for. You write down the large and small things that you've accomplished in your life, and you write down the talents, the things you're good at, or things that other people would say about, positive things people would say about you. And again, keep it close and review it, especially if you're having a day when you're experiencing some negative emotions or a setback. When you start an activity, I tell therapists I work with to start and end your therapy sessions on a positive note. Find something positive to begin the session, something positive to end the session, and do the same with your day or your activity. Help others. This is using your strengths in the service of others. This is a way to connect with something larger than yourself. So this brings meaning into our life. So practice a random act of kindness when you go to a clubhouse meeting. If you can, bring coffee for everybody, or just again, open a door for someone. Give someone a smile. They're free, and you have an unlimited number of them. Avoid downward comparisons. Rather than thinking, I wish I had a bigger house, instead say, I'm glad I'm not homeless. So rather than thinking, I wish I fill in the blank, say, I'm glad I'm not. And it may trigger some thoughts about a cause you can join. Again, rather than saying, again, I wish I had a nicer place, I'm grateful I'm not homeless. Well, maybe that will inspire you to figure out what you can do to help the homeless in your area. Rather than, wishing you had a steak dinner, I'm glad I'm not hungry. I've got food in the pantry. Maybe that makes you think about the people that that visit your food bank, and maybe you want to make a donation to your local food bank. All right. Focusing on the future, I think it was Mark Chestnut who no, not Mark Chestnut. It was Brad Paisley who wrote a song about writing himself a letter from the future, and he's writing a letter to his teenage self, telling him not to worry about who he's going out with and those pimples on his face and whatever. It's all going to work out well. You're going to be fine. And so writing yourself a letter from your preferred future, you're doing the things that you want to be doing, and look back on what you did to get there. That's often can be helpful and put you in a positive mood, help you identify some things to do, next steps to get to a larger lifetime goal. If you have a spiritual practice, I suggest you engage in it. Organized religious activities provide social contact. We're able to give and receive support. There are liturgical seasons that sort of keep us oriented and grounded. And then obviously there are the scriptures from your religious practice, whatever that's being. So I'm familiar with the Christian Bible, so I'm familiar with some verses. If God is for us, who can be against us? I'm persuaded that neither life nor death, nor my brain injury, nor my whatever is going to separate me from the love of God. That's powerful. And so, if you have a spiritual practice, I encourage you to engage in it. We can also boost a positive emotion by engaging in positive coping strategies. So there are what's called negative or avoidance oriented strategies, where people want to withdraw, engage in wishful thinking or blaming others or numbing out using drugs or alcohol. These negative or avoidance coping mechanisms have been associated with high levels of anxiety and depression and low levels of self-esteem. So what we want to do is engage in positive coping strategies, or what's called approach-oriented. So we want to identify the problem, not avoid it. We want to come up with as many solutions as we can. We want to obtain information about what we can do about it, and then seek assistance from others if we need it. We may want to alter the environment if we can, or find out what, reappraise the situation as positive. There may be something positive in this situation. There's also this concept of benefit finding or adversarial growth. So sometimes when we face a challenge, there are lessons to learn from it. So what is the universe trying to teach me here? What can I learn from this situation, even if it's temporarily challenging or it's causing me some stress or anxiety? What can I learn from it and be better by it, be better from it going forward? So a lot of people, when I deliver this talk, say, well, that's awesome, that's really nice, Gary, but does this stuff work? Does this stuff work at all? And actually it does. It works very well. Individuals, obviously, who are motivated, who are excited to practice new things, tend to do better with these strategies. Again, the older folks tend to do better with these strategies. But generally speaking, this is something that we just need to practice and incorporate into our daily routines. Research has shown that people who sort of try to fake it till they make it, or who work too hard at trying to be positive, actually that it can backfire. This really has to be a lifestyle change that we incorporate into our daily routine. So again, just in wrapping up, positive emotion is a dynamic process that can and does change over time. We know that regularly experiencing positive emotions is associated with better health and better recovery. Positive emotions are modifiable, or the experience of them. So there are things we can do to experience positive emotions, and again, perhaps have an impact on our health and well-being. And I always encourage rehabilitation units to incorporate positive psychology practices into their rehabilitation protocols. There's so much information out there. There are books, research articles, websites, TED Talks. You can even take a signature strength survey to find out what your signature strengths are and how to use them to boost positive emotion in your life. And again, some helpful websites that you can explore. So remember, life's not about waiting for storms to pass. It's learning about how to dance in the rain. And the only true disability is a bad attitude, and you can change that. And if you want to see what positive emotion looks like, this is my granddaughter, Audrey, and her pops have just said something amusing, and she's having fun with it. So I get a lot of positive feelings through my relationships with my grandchildren. So here's a time when we can address any of your questions. So the floor is open.
Thank you so much, Dr. Seale. If you could stop your screen share.
Sure.
And there's just a couple of things that really stood out for me as I was listening to you. One was the importance of meaning and purpose. And I think that we see that a lot, in our community, which is the journey to finding like your new self, new purpose, because often individuals after a brain injury have to really redefine their place in the world, and it's often a struggle to find a new meaning or sense of purpose. And so I encourage everyone to continue on that journey, because sometimes it's hard to go through your day if you have no purpose for that day, or feel like you have no meaning in your life. And if you find a purpose, and it can be simple, it can be, I've talked to folks that started volunteering, and things like that can really add a meaningful sense of purpose to your life. It doesn't have to be this constant struggle to do what you did before your brain injury. Another thing that I love is the idea that that quote you had, Dr. Seale, which is the only true disability is a bad attitude. Now, I want to give folks an illustration to sort of really understand how this can work in your lives. I encourage you, if you've gotten our most recent newsletter, to read those survivor stories in there. We gave out 4 small scholarships to brain injury survivors that are pursuing higher education recently. And we've put a summary of their stories in our newsletter, but also if you go to our website, you'll see their full essay that they submitted to be considered for a scholarship. And you're going to really see that mentality in the individuals that are pursuing higher education after sustaining a brain injury, and the realization they came to, which was like attitude was everything. And not things like one individual, really it was a quote saying he's choosing to not let his disability define him, and to really define his disability and what that means in the context of his life. And just the mental strength of overcoming these seemingly insurmountable challenges is just really, really inspirational. So I just wanted to say those things, those couple of things in your presentation really stood out for me.
Yeah, well, thank you. And you're right. When we talk about meaning and purpose, you don't have to cure cancer to make a difference in somebody's life. Again, and sometimes those downward comparison exercises where, rather than saying, I wish I'm glad I'm not, and then turn that into a cause. Again, donating to a local food bank, volunteering at the animal shelter. Again, starting a blog where you put some of your survival stories, resilience. People love resilience stories. I read them all the time about people who bend but don't break, who get knocked down but get right back up and keep going, and that's what it's about.
Yeah, and I'm going to get to Cheryl in a second, but that way you just said, knock down and keep on going. One individual who received a scholarship said something along the lines of, getting knocked down is part of life. And it's how you get back up. And it's really a part of everybody's life, regardless of your situation, is feeling like we've fallen down. Yeah, Cheryl, it's an interesting point though, right? Because, like Dr. Seale, you said, and we know this from research, right? Which is a strong social network, outside of maybe people you don't know on Facebook, can really be a protective factor for your mental health. And so, environmentally, these times are sort of challenging, not only to establish, but also to maintain that social network, right? But, what if things have changed or you've moved? And even after, let's be honest, after a brain injury, I've talked to many folks who've lost, their social connections and have had to really create new ones. So, that challenge of what if your social network has sort of evaporated for whatever reason, and what do you do at that point? I don't know if you have any comments about that, seeing as having this social network is a real protective factor.
Yeah, I agree with you 100%. And Cheryl, I wanted to say that, I experience the same thing. I'm very social as well. And in fact, the social aspects of work are very rewarding to me. And so when our clinic was locked down and I couldn't go to work and I was having to do all, meet with my team via Zoom or doing therapy via telehealth, it was really hard. But people got real creative. We started having virtual happy hours where we couldn't meet at the bar, but we could all get on a meeting like this and have a toast. We had game nights where we did Pictionary and put the picture up in front of the camera. We found ways to connect socially, and just got real creative and felt very connected until things loosened up again, where we could begin with some precautions to meet in person. So I would just encourage you to reach out to those people that you do have a connection with, and just try to get creative, and have a game night, have a virtual happy hour, have a read, all you guys read the same book and have a book club discussion night or something. There's lots of ways you can stay connected, and have some fun too.
Yeah, and I wanted to add to that, even things like the ABI program, right? The Acquired Brain Injury program, things like volunteering, because Dr. Seale mentioned, work, and that's part of his social, outlet as well, right? At work. So even those types of things where if you can connect with a volunteer opportunity or connect with a program like the ABI program, those are going to present some opportunities to sort of build a new social network as well.
Thank you.
I don't know your name, but Synapse's TBI Life Coaching. What is your name? You had a question?
I was actually wondering about the connection between medication use to help with mood enhancement versus, the strategies that people use for positive, team building or lifting themselves up. Have you noticed, or are you noticing that some of those other methods may be taking place of some of those medications, or are you seeing changes like if you're using both? I just wondered if there is a relationship between the two. And I just wondered.
No, that's a great question. And you remind me of this concept that things are on a continuum, right? So there are people who may experience sort of the normal ups and downs, and maybe have more downs than ups, and so just using some of these strategies alone can be helpful without using medication. Then there are people on the other end of that continuum who are so anxious or so depressed that they really are immobilized. They don't have the energy to even engage in some of these strategies, or they're not sleeping well, or they're overwhelmed. And so they need the medication to provide enough of a lift to allow them to engage in some of these. So I think that it depends on the person, but even the most of the medication or pharmacological studies out there show that the medications work best in combination with talk therapy or some other type of an approach. So I would say that there's certainly a place for medications for folks who are experiencing pretty significant symptoms, and you can pair them with counseling and also these strategies.
Okay.
Good question. Well, you're very welcome, Lauren. And you bring up a great point, and I would challenge anybody that's participating to try it, to sit down and try writing 3 good things, because like Lauren said, it seems easy, but we tend to be so focused on the negative. We tend to be focused on what's wrong and not what's right, that when we sit down to come up with 3 good things, it's like, wow, I'm having trouble with this. When I do this exercise live with people, it's like crickets in the room. Who's got something good to share? It's like they have to think about it. And so the point that you're making is that this truly, it seems simple, but it's not, because we're wired the other way. We're wired to look for threats in the environment. We're wired to look for, what might be dangerous out there and protect ourselves from it. And so this really is all about shifting how we think about things, how we perceive things, and practicing looking for the good. Yeah, I'm, again, Tiger, I'm not really familiar with your history and what has been tried previously. I do know that there are a number of off-label uses that have been successful for people. Also atypical, what they call atypical, using a medication for a different purpose. All kinds of things are out there. Like Neurontin was developed for seizures, but it also helps with pain management, right? So medications can be used in different ways because people respond to medications in a very individualized fashion. So I would just, if you are anxious or nervous about this medication change, I would just be frank with my prescribing physician. I would talk some more with your psychiatrist about his or her thinking, and maybe take it slow. Maybe get a second opinion if you're nervous about it. It really is. It's your body. It's your recovery. I think if you're concerned about a direction that your physician's going, that's time to have a frank discussion with your physician and just share your concerns.
And maybe getting a second opinion if you remain concerned. And I think that's probably some of the most solid advice, right, in this area.
By the way, I'm just so you know, I'm not a medical doctor. So I don't prescribe medications.
But you know a bit about them.
I know a little bit about them, right? But full disclosure. What makes you think you're going to have a breakdown, and do you have to? Do you have to go there?
Right after I got out of the hospital and was able to go to work, go do everything by myself now, I began to overthink things, and I would have breakdowns at home at night.
So do you?
So I would have breakdowns, basically saying I regretting everything I lost, and
So Christian, do you have a support group? Do you have some friends you talk to or family that you talk to?
Chad gives me some help sometimes. That's basically it. I don't like talking about it to my family.
Okay, because what I heard you say more than one time is you're sort of in your head and you're overthinking it. I heard you say that 2 or 3 times. So it seems to me like a strategy to sort of get you out of your head and get you talking to other people, or get you out of your head doing something a bit more positive. You know, we talked earlier about a lot of folks, including me, have this occasionally I'll get in my head and I can't get out, and I just do that. I ruminate on something, you know, and usually it's something negative that happened during the day, something I could have done better at, and I have to pull myself out of that, and I usually do it by looking at some reading, or looking at a video clip, or I'll go to a YouTube video of something that's funny or something that's inspirational, and it really changes my mood.
I know how to get a hold of Christian, so yeah, if you wanna email that to me,
yeah,
I can send that to you, Christian, because there's a slide in there exactly about you're kind of getting stuck in your head and overthinking things, and how do you sort of jump out of that.
Okay.
Yeah, and again,
Thank you.
You're welcome, Christian. The more you, and again, it's a common thing. I know I sometimes my head is a dangerous place to be, and I have to get out of it and talk to somebody, or talk to myself a little more gently. It sounds like you've got a couple of strategies that are already working for you, and I forgot to ask what has been successful for you in the past, because if you have had some success with those strategies, let that be your go-to. But again, you can develop additional strategies too. Maybe this slide will help come up with some new things. Like I said, what works for me is reading, or going to YouTube and viewing something either inspirational or something humorous, and that pops me out of a negative mood pretty quickly. But again, we're all different, and what works for me might work for you, might be something different. But there's plenty of material out there, and it can be as creative as you need to be. Cool. Well, Kurt, I will share I'll send you my PowerPoint, and you can send it to whoever's interested.
Okay. Yeah. Thank you so much. And I will share that. Christian, I'll email that to you.
Okay. Thank you.
Any other questions? 1 second. I'm just writing something down here. Okay. Well, thank you so much. If there's no other questions, thank you so much, Dr. Seale, for your time today. Really, really appreciate it. I know it's a Saturday, and you're really generous with your time for coming here. I think we'd love to have you again. Maybe next year or something. I think you're just your way of framing this information, I think is very helpful, and just really appreciate your expertise here.
Well, my pleasure. I am flattered and honored that you guys invited me to be a part of this, and I would definitely come back. Would honor the invitation.
Thanks so much. Well, everybody, I hope you have a wonderful rest of your day. Thank you for joining us today, and take care of yourselves.
Okay, thank you.
Bye-bye.
Have a great weekend.
Thank you, everyone. Bye.
Thank you.